It's the new year and we're all trying to eat better or exercise, but sometimes you reach a point where something else is needed to reach your goals of being healthy. Well, the difference is TGH and USF Health Bariatric Center. Joining us today are Dr. Chris DuCoin and Dr. Ashley Mooney to tell us all about it and most importantly, how they can help you achieve your goals. Welcome to the show. How are you today?
Great. It's great. Good to be here. Thank you for having us.
So let's talk about this procedure. I feel like you kind of hear these things once in a while, but let's get down to the nitty-gritty and how can you help?
Yes, it's a great question. I think a lot of people hear about bariatric surgery and don't quite understand the process or the commitment to it. And what is different maybe about TGH and USF is it's a large academic center and a massive hospital, 1,100 bed hospital system. So we're able to take on a breadth of patients that a lot of other centers can't, from transplant patients to kind of the people just looking to lose weight. We offer a multitude of surgeries from robotic to endoscopic surgery, and we can kind of help anybody really achieve their weight loss goals. We really have no restrictions, again, just because of the infrastructure we get to work with. We can take care of adolescent patient populations up to elderly. So we really do, I think, a good job at helping everyone.
Well, something you just said there in the beginning was that it's kind of a process. It's not like a one-stop, you go in and you're done. Let's explain what people need to know before maybe moving in this direction and seeing how you can help.
Yeah, so the process is actually amazing at our center. We have a whole team of dedicated providers that are able to help these patients from the very beginning to the very end really achieve their goals. So anybody, we don't turn anybody away, but any patient can come and sign up for a free information session. We hold them every day. And they learn about bariatric surgery, how weight loss surgery can help them really achieve their goals. It's not just about losing weight, it's about getting healthier. Our dietitians, psychologists, nurse practitioners, cardiologists, pulmonologists, obesity medicine physician, and the surgeons, we all work together to walk them through the process where insurance pays for them to have weight loss surgery, and that's just the beginning. We help them achieve their goals for years after. They follow up with us for forever.
Oh, I love
and so
that.
we make sure they maintain that and there's no real weight regain because we're their second family.
I really like hearing that. It's not like sending out the door. Well, we were actually taking a look there at some before and afters while you were talking, which of course were so impactful to see, again, the stress of just healthy. Let's talk though, people at home that may be watching and they're thinking, I don't know if I'm there yet, I am there yet, what do I do? What do people need to keep in mind?
Yeah, so there's a couple things. One is, do you qualify for it? So these criteria that have been established, they've been around since the early 90s, and it's based off of your BMI or body mass index, right? So your BMI has to be greater than 35 and you have to have a comorbid condition, which almost everybody has, or your BMI has got to be greater than 40. Once you kind of reach those criteria, then what we do is we evaluate you for surgery. And part of that preoperative process is safety. So the usual time frame from when you meet us, you come into the system, to when you go to the operating room is about 6 months. Patients will sometimes say that it's a little long or they get frustrated with it. But the thing that we like to stress so much is that preoperative process has made this surgery one of the safest surgeries we do. It's as safe as having your gallbladder removed, as safe as a hysterectomy, it's as safe as elective knee surgery. And a lot of that has to do with all the time, energy we put in upfront to making sure the patient's healthy, both mentally and physically prepared for surgery.
I'm so glad to talk safety. That's a really good one to end on. If you have more questions and you just want to visit the website, phone number, all that information is right there on your screen. Again, doctors, thank you for being with us and talking about this today. I know it can help a lot of people.
Thank you for having us.
Thank you so much.